On-the-scene coverage of ACC-14 is supported by Janssen Pharmaceuticals, Incorporated.
I'm Peter Block here at ACC for On the Scene, and we're covering the late-breaking clinical trials at ACC at the annual meeting. With me is Chris Lexis from the Netherlands, and Chris has done a study on the use of Metformin in acute myocardial infarction. Sort of a strange study. I asked Chris, why would you ever do that? So I'm going to ask Chris, why would you ever do that?
Well, the Gips-Iii trials showed a survival benefit with the use of metformin independent from glycemic control, and it suggested that there were additional cardioprotective effects of metformin. So subsequently some animal experiments showed that metformin resulted in improved left ventricular function after MI. And that was the main reason that we tried to study the effect of metformin in patients with acute myocardial infarction.
So the hope was that you would get better ventricular function after this, that there was some other pleiotropic effect of metformin besides the glycemic control.
Yes.
So tell me how the study went forward. You randomized in acute MI, big ones, small ones. What did you try to do?
Well, we randomized patients with their first MI without diabetes, and they had to undergo PCI with one stent at least of 3 millimeters in diameter. And so we performed an MRI 4 months after the MI for left ventricular ejection fraction, and that was the main outcome parameter of the study. And the secondary outcome measure was NT-proBNP levels at 4 months, and we found no difference. So we did not observe any effect of metformin on either left ventricular function or on the NT-proBNP levels.
So no difference for any of the endpoints?
No difference for any of the endpoints. We're still looking at some other secondary endpoints like infarct size or diastolic function, but globally no differences.
Well, I'm sure you were disappointed. I was disappointed to hear you say that, but the fact of the matter is, I guess metformin is not going to be used in acute MI. Do you think there will be further studies?
Well, I think that there are some limitations to our study which make that should there be an effect, which we didn't find, but should there be an effect, that with different study designs maybe it can be observed if administered even quicker than we did or directly during inflation of the stent or something like that. But I really don't see a lot of possibilities since we did not see any effect on any endpoint.
So for all you metformin lovers and patients who are non-diabetics and have infarcts, probably not worth giving it a try, but thank you very much, Chris.
Thank you very much.